Hello, welcome to NMA Live, where we feature the leading physicians and experts in African American health. This program is specifically designed for a non medical audience and is brought to you by the National Medical Association, the collective voice of African American physicians and the leading force for parity and justice in medicine. Be sure to like and share this video. I am Dr. Garfield Clunie. I am a board certified maternal fetal medicine specialist. I'm an associate professor of OBGYN in the Department of OBGYN at NYU Langone in New York City, and I'm also vice chair for the Department for Diversity, Equity, and Inclusion. I'm also the 123rd president of the National Medical Association and will be your host today. The theme for this month is Health Heart, and of course, this is also Black History Month. And at this time, I'd like to introduce our expert speaker for today, Dr. Hakeem Ayinde. Dr. Ayinde is board certified in cardiovascular disease, echocardiography, electrophysiology, and internal medicine, and is in private practice at Cardiology Associates in Fredericksburg, Virginia. Thus, he is well suited to discuss the topic of heart health and answer your questions, which you can send through the chat or comments feature. Welcome, Dr. Ayinde.
Thank you for having me, Dr. Clunie.
So let's go ahead and get started. So tell me, why is heart disease so common in African Americans?
That's the question. We see the numbers. We know that heart disease is the leading cause of death in the United States. One person dies from cardiovascular disease every 34 seconds in this country.
Wow.
Heart disease accounts for 1 out of every 5 deaths in this country. African Americans are 30% more likely to die from cardiovascular disease compared to non-Hispanic whites. And I think the biggest questions really, it's not like we necessarily should genetically designed to just die from heart disease. It's more of a disparity in risk factors and the environmental stressors, which we'll get to later. But let me just start by focusing on the risk factors. So the major risk factors for heart disease are high blood pressure, diabetes mellitus, obesity, high cholesterol, cigarette smoking, and the environmental stressors.
Many of those medical issues are more prevalent in our community, in the Black community.
Yes. And when we look at the numbers, if we look at the numbers, for example, if we go down to I have a slide. I think I have a slide on the hypertension. Yes. So on this screen, you can see this is the relative prevalence of high blood pressure in the different ethnic groups. And you can see by far, African Americans have a higher prevalence of high blood pressure. It's about 40% compared to 20-something% in other groups. So that's a big one. High blood pressure specifically is the single most important risk factor for stroke. Very important risk factor for heart failure. Very important for other cardiac diseases. If we look at, let's look at another slide, diabetes. If you look at the prevalence of, diabetes, you can see that Blacks and Hispanics have about a 20% prevalence of diabetes compared to, much higher than our non-Hispanic whites. If we look at obesity, obesity is another risk factor. So this is one looking at children, our children. So you can start to see a difference. You can start to see a disparity setting from a young age, from the age of 6. Non-Hispanic Blacks, 25% of Black children and youth are obese and at a high risk of cardiovascular disease. So obesity is something that it's a very big one and it keeps growing. If we go to a slide on adults too, you can see that the prevalence of obesity in adults, about 48% of African American adults have obesity. I'm not talking of overweight. If we talk about overweight, we're talking about 70 something percent.
Wow.
But just obesity with a BMI more than 30, we're talking about 48% of African American adults,
Wow.
which is about 30% higher than that's seen in non-Hispanic whites. So these are the three cardinal risk factors again: hypertension, diabetes, obesity. You can see that they segregate more in African Americans compared to other groups, and that explains why African Americans have a higher risk of heart disease. For example, I'll give you another example. If you look at a disease like atrial fibrillation, African Americans have um, a lower prevalence of atrial fibrillation. We call it the AFib. We call it the AFib paradox. But despite having a lower incidence of atrial fibrillation, African Americans are twice as likely to die of stroke, to have stroke and die from it,
Yeah.
than other groups. So it's just that heart disease tends to find black people and kill black people more. And it's not just if we look at, it's not just the risk factors alone. I think we have a force multiplier in society, the psychosocial and environmental stressors, which I think, you know, we should actually dig more when we talk about, controlling, prevention. Those are actually force multipliers that if we have policies that can address those, then we will have a better chance at actually controlling, reducing these health disparities.
Right. Right. So, an interesting a phrase you just said that it seems to find Black people. Right. I think that's a very interesting term. Would you say there's evidence of any genetic predisposition?
Not per se. There's one interesting blacks don't have a genetic predisposition to heart disease, but there's some interesting thing when we look at high blood pressure. Um, Blacks all around the world appear to be salt sensitive,
Hmm.
meaning that if you consume the same amount of salt as other ethnic groups, you're more likely to have high blood pressure. Which is why when we treat high blood pressure in blacks, we we tend to diuretics are one of the most powerful drugs because they actually reduce the salt in the blood. So salts, when we talk about treatment of high blood pressure, it's always a very so reducing salt is a low hanging fruit.
Right, right. Yeah, that as we go to the supermarket and we look through the things that we buy, especially the processed foods, we really have to look and see where that salt comes into the preparation. That, as they say, the closer it is to the word ingredients, the closer it is to that beginning, the higher the amount it has in that product, and you really have to watch out for that.
Right. And most of the salts, like 80% of this salt actually comes from processed food. It's not. Yeah, so one of the ways to reduce salts is actually by cooking your own food, like processed food, bacon, canned food. They store these things
Don't
by.
talk bad about bacon now. Come on.
Well, everything in moderation. I'm not a. I don't tell people, hey, do not drink at all. Do not.
Right. Understood. Absolutely.
Moderation. Moderation. You can have your red meat once a month, maybe.
Right, right. But while we're on the subject of diet and trying to eliminate certain things from your diet that are more heart healthy, as they talk about the social determinants of health, sometimes the stores that are or supermarkets that are in your area or the corner stores may not provide the best food that you would want to intake if you're trying to have a heart healthy diet. Tell us a little bit more about that. How the social determinants of health can, affect what happens with someone with heart disease, or even developing heart disease, developed heart disease.
Excellent question. It's all about the zip code. It's all about the zip code. If you look at if you just look at the map of America, look at where heart disease lies. It's all about the zip code.
Yeah.
Um, yeah, African Americans are more likely to live in food deserts.
Yeah.
These are places where you don't have access to, fresh food, fruits,
Right.
vegetables.
Right.
The you'll probably see like maybe you go around before you see a grocery store, you might see more fast food restaurants,
Right. Right.
because yeah. So the other thing is same thing about zip codes when we talk about, just look at neighborhoods now, look at your walkability score.
Hmm.
That
Very important.
Americans live in areas where there are no parks. There's, you live by the
No
highway.
sidewalks. Right.
So yeah, so that too, so that limits physical activity, exercise. Yeah, so
Right. Right.
uh
And on
yeah.
the same token, we talk about, sorry,
I was going to talk about stressors too.
but I was going to say, on the same token, when you talk about food deserts, they talk about food mirages as well, because there's certain neighborhoods that are being gentrified that may have very high end
Yeah,
supermarkets, which is great, but some people in the vicinity, can't afford to
can
go in
afford
there.
it.
And
Yeah.
so it's really a double-edged sword sometimes, because they may be there, but then you can't even use it. So the mirage effect is there.
I used to live in New York. And one of the things I miss about it is, how you have fresh, like you live in the city, but you have fresh food. You have fruits by the corner. So those things are things I wish they could replicate in other cities where, yeah, you, despite living in a city, you should, or you should be able to support farm
Right.
to the
Right.
table, like
Right.
in
Right.
ways that are, ways that move that community
Yeah.
forward.
Yeah. Interestingly enough, I know I'm going to say this name wrong, but in the comments, one of our participants, Marutina, I apologize if I said your name wrong, but it says not even a community garden around sometimes to grow fresh vegetables. And that's exactly what you're talking about. I live in Harlem, and they're varying, there are lots of different socioeconomic people that live in Harlem, but we do have, fortunately, some community gardens in some of the open lots, which is great, to actually teach young kids how to farm on their own, but also, that it's going to bear fruit, and eventually you can use that fresh fruit that's not processed, and not, organic, so to speak, to supplement your diet.
Right.
Yeah, no, it's a very important point. The social determinants of health, it cannot be understated how that affects someone's ability to improve their health and avoid these kinds of health challenges. So, as a cardiologist, a cardio electrophysiologist, I know you see a lot of patients who have significant and severe cardiac disease. And what do you think? We talked about a little about how to do preventative measures, but talk a little more about how people can prevent, getting going down this road of terrible heart disease, needing cardiac catheters and stents and all those things.
Right. America is great at, I think if you want the best healthcare in the world, you come to America.
Hmm.
Um, we have we have the best of the best that we can offer people, but
Hmm.
that is for each patient. COVID exposed the weakness of the healthcare system.
Yeah,
We're
absolutely.
bad at population health. We're bad at prevention. The
Yeah.
best way to reduce uh, heart disease, to reduce stroke, to reduce heart attack, heart failure, the best way is prevention. Let's talk about the risk factors. High blood pressure. The best way to prevent high blood pressure is exercise, food. So exercise, I showed that. You look at that. Look at the childhood obesity rates. This is alarming. If you go to the
Right.
slide, it's almost 25% of African American children are obese.
Wow.
That is alarming.
Yeah. Yeah. Okay. And before
So
you go
we
on,
have to start.
right, before you go on, define exercise to help me with, help us with all knowing what exercise is, because exercise is not what we see on TV. It's not getting on a Peloton. It's not, getting on all these things. No offense to Peloton, but that's not necessarily, the definition of exercise.
Right. And exercise can mean different things to different people. It really depends on your physical health and all that. But in general, we advise that you so first of all, we advise that you do a form of cardio. It could be getting on a Peloton, or it could be for someone else just fast walking. Something that can get your heart rate up for at least 30 minutes, 5 days a week.
That's the key.
Yes.
Everybody should take that away. That's the key.
Yes. New York, all you got to do is drop off at a stop before you get to your, one stop early and walk home. Things like that.
It's a nice brisk walk home. Yeah. Yeah.
Yeah, take the stairs, don't take the elevator. So those are ways you can even if you have long hours at work, you can still do things at work to exercise.
Right.
Right. So exercise, number one, that's important in reducing those risk factors like obesity and hypertension. Food, the kind of food we eat. We'll talk about reduce. So basically, the structure of the food should be uh, a very balanced diet where you don't have more than maybe like 30-40% carbs, um, then proteins and unsaturated fats. And you want to do a lot of fruits and vegetables.
Mhm.
And you got to make sure for your fats, you do avoid saturated fats. So saturated fats comes from your animal fat, mostly animal fat. So that's
Try to
why,
reduce that. Hmm.
yeah, there was this nice study that showed that when you talk about cardiovascular disease prevention, when you just talk about food in general, like in terms of healthiest to least healthy, so vegan food actually was associated with the longest life expectancy. Of course, yeah, but mostly because it's plant based and
Plant-based.
yeah, and it avoids those animal proteins. So after vegan, then it's vegetarian, then pescatarian, then people that eat chicken. So red meat is really bad. So pretty much that's the point. So if you can try to avoid red meat as much as you
Red meat
can,
is not optimal. Right. Yeah. It's
yeah. Um, and then yeah, your fruits and vegetables. Eat a lot of nuts and yeah.
right.
So
Right. No, diet. Yeah. Diet cannot be understated. But I want to go back a little bit too on when we talked about sort of social determinants, because one of the social determinants is your environment in terms of pollution and where you live and things like that. And I was reading the other day, preparing for another talk I was giving, and I read that after, and I knew that I reread it after the Genome Project, they found that we were all 99.9 the same genetically, all 99.9, and that 0.1%, they said that may account for the differences in how we all react to diseases, and that may be a factor of the environment you live in. So tell me a little bit about that.
So, I mean, if you look at a good one is the asthma rates in African Americans. Why is it high? Because kids are exposed to environmental pollution.
Yeah.
So the environment you live in, even there's this. If you look at literally, if you look at a disease like we'll call it medically, we call it Takotsubo syndrome, which
Sorry,
broken
call it what?
Takotsubo, but in
Okay.
more common name for it is broken heart syndrome, where
Okay.
literally you develop you develop heart failure because of stress.
Hmm. Hmm.
Like if you're exposed to a very high stressful event, for example, some really catastrophic events, some people just can develop, heart failure. So that's an extreme form, but a lot of African Americans live in not just stressful environments, but even what you're exposed to every day, like uh, structural discrimination,
Hmm.
institutional discrimination. These things,
Absolutely.
these things just, your set, like your set points is just not chill.
It's right,
You know,
exactly. Your set point is already way up here. Right, right.
yeah,
Over
this
policing, all of it counts. It puts a stress on
yes,
you that, baseline, your day starts out stressed. Yeah, absolutely.
yes, and you're like, why is my blood pressure so high?
Right, right.
So those are things that you can't quantify, but they actually account for way more than we can measure. I'll say.
Right. So we all apologize for that. So what, and I think the take home message is that, when we talk about, oh, I'm so stressed out or this one is stressing me out, sometimes it's worth just taking a step back, taking a deep breath and realizing that sometimes it's really not that serious because you may think in the short run, it's no big deal, but it does affect your health. It affects your overall
Yes,
health and your overall functioning of the day. So
yes.
that cannot be overstated how stress can affect your health.
And the other thing is, the other thing we've not mentioned also is regular checkup.
Yes.
Regular checkup. Most people, I mean, you see this, I see that. You see people that have been healthy all my life. Guess what? If you have a car, tell me you have a car, and you're like, you don't do your 6 month checks. You're like, no, my car is good. It drives
You
great.
don't change that
No,
oil. You don't do anything. Right.
that's the same thing with the human body. If
Right.
you think you're healthy, oh, I've been healthy, I feel great. No, you need a checkup. You
Yeah.
might need a tune-up. See your primary care doctor, check your blood pressure. In fact, talking about blood pressure again, because that's a big one in the African American community. Get a blood pressure machine at home. And here's why. When you go to your doctor's office and you check your blood pressure, most of the time that's one reading. That doesn't tell the whole story. That's not where you live every day.
Right.
So you should check your blood pressure in your normal everyday life. So checking your, like, what I advise my patients to do is check your blood pressure every day. When you come to see me, bring a log. That's
Yes.
really what I can
Very
tell.
important. Yes.
Yeah,
Yes.
your pressure is controlled or it's not controlled. We can do this. That one read in the clinic, no, doesn't do it.
No, absolutely. As a doctor who takes care of high risk women, some of them with hypertension, I give the same advice. I'm a little more stricter with 2 times a day, once in the morning and once in the evening, because it is pregnancy. But I agree with you. And keep that log so that your doctor can look at it and explain to you if you're really in good health or you have something to watch out for. No, that's extremely important. Prevention and self care, very important to learn. So as we wrap up, what do you want folks to know about their heart health and what they should be doing again on a daily basis, and how to navigate health and going to the doctor?
So I think, importantly, one is we need to understand that heart disease is the leading killer in the United States. And we need to know that we black folk have a much higher risk of dying from heart disease than other
Right.
communities. But it's not all bad news. There are things we can do about it. And that's
Right.
why we're having this conversation today.
Right.
It's not too late to act on it. Remember the cardinal risk factors for for heart disease. We're talking of high blood pressure, we talk of diabetes, we talk of obesity, we talk of cigarette smoking, we talk of high cholesterol, we talk of then environmental stresses, which sometimes you can't, maybe out of your control. But at least the first ones you can control. Get a blood pressure machine, check your blood pressure. If your blood pressure is high, work with your doctor or your care provider to help get your blood pressure down. That's important. High blood pressure is called the silent killer because
Silent killer. That's right.
yeah, you don't have any symptoms.
Yeah.
But guess what? In 30 years' time, it's going to cause a stroke. It works its
Or
way
kill your
slowly.
kidneys. Right. Yeah.
Kill your kidneys, kill your heart.
Mhm.
So it's not a one-day thing. That's why when I see people go to the hospital or have pressure is high today, no, not today. It's a years-long thing. So
Right.
control your blood pressure. Um, Control your cholesterol. Obesity, strive to lose weight. It's very, we can't, like, the obesity pandemic is real, and it's driving cardiovascular disease. So losing weight is critical, I'll say. Stop smoking, and finally, remember your exercise. Try as much as possible to exercise, and it's just do some physical activity, increase physical activity. That's what it boils down to, in your own
Right.
little way.
Right.
Do
Even like you said,
more.
walking is not to be understated. I mean, walking can help as well. It can definitely
Yes, and the food you eat, avoid fried food. Try to limit red meat. Reduce sugars, reduce salts. Eat a lot of fruits and vegetables, and yeah.
Yeah, yeah, and one other comment from that same participant, Maruchina. I apologize, I'm probably butchering your name, but health literacy in some communities, very
Yeah,
very important, very important for
very.
community centers to really try to reach out as best they can because they're local on the ground to try
Yeah.
to instill some health literacy.
Yeah, when you go to your care provider, okay, so what's the status of my health? How am I doing? What's the outlook for me? Don't just go, I'm like, oh yeah, I saw my doctor today. What did he say or she say? Oh well, just let's see me in 6 months. No, you have to be a part. You're a partner in your
Yeah,
healthcare.
yeah,
So you
yeah.
have to understand, and that way you can do better with your health.
Very very important. So I think the take home messages are, we know that heart disease kills more African Americans than any other ethnic group. So we really have to be mindful of what we're putting into our bodies and how we're taking care of our bodies. We don't want to take care of our cars, our pets, our homes, our lawns better than we take care of our own bodies. And again, from what I heard, is the psychosocial stress in the environment. That is a big factor on what can happen to your health. And some of us, we are limited in where we may be able to live, or you know, or what our environment has for us. Sometimes we don't have control over that. And I'll just add to that: voting is very important. Vote for people who look out for your best interest and your community's interest. Very important. But try to eliminate as much stress and the environmental issues that you possibly can. And then like Dr. Inde said, diet. I could lose some weight myself, and I could eat less red meat. And I think after this talk, I'm gonna have to really think about that. Eating less red meat, because that does contribute to heart disease, probably a lot more than many other factors that you come involved in. And I'm a big factor walking. That is really something, a simple thing you can do to help keep your body in shape. um, Anything else you want to add, Dr. Ayinde, as we close out?
I think you summarized it very well.
Great, great.
So it's just the health literacy part is critical.
Yeah,
You have to be a partner in taking care of your health. Yeah.
right. Absolutely, absolutely. Great. Well, thank you again. I think this was very informative. I hope our participants enjoyed it. And thank you for tuning in, guys. And have a great, heart healthy day. And happy Black History Month. Take care.